Your body has been trying to tell you something for months, maybe even years. And you've been ignoring it. What if I told you that the thing you dismissed as just being tired could actually be your body screaming that something is seriously wrong? That headache you blamed on stress? That constant thirst you thought was normal? They might be warning signs of diabetes, and you're running out of time to listen. Right now, millions of people are walking around with diabetes and they have no idea. The scary part? By the time most people get diagnosed, the damage has already started. Their eyes, their kidneys, their nerves, all quietly being affected while they thought everything was fine. But here's the truth that could save your life. Your body gives you warning signs long before diabetes becomes a crisis. The problem is, these signs are so common, so everyday, that we brush them off as nothing. Today, I'm going to reveal 7 signs that seem completely normal but are actually your body's desperate attempt to warn you about diabetes. Some of these will shock you because you probably experienced one just this morning. And by the end of this video, you'll know exactly what to look for and what to do about it. So let's dive into the first warning sign that almost everyone ignores. The first sign is constant, unquenchable thirst. Now, you might be thinking, everyone gets thirsty, right? But here's the difference. Normal thirst goes away after you drink water. Diabetes thirst doesn't. You could drink an entire bottle of water and still feel like your mouth is a desert. Why does this happen? When your blood sugar is too high, your kidneys go into overdrive trying to filter out the excess glucose. To do this, they pull water from your tissues, making you desperately thirsty. But here's where it gets worse. The more you drink, the more you need to urinate, which leads us to our second warning sign. Frequent urination, especially at night, is something most people blame on drinking too much water before bed. They think it's normal aging or maybe a weak bladder. But when it's happening multiple times every single night, that's your body waving a massive red flag. High blood sugar forces your kidneys to work overtime, flushing out glucose through your urine. This creates a vicious cycle. You're thirsty, so you drink. You drink, so you urinate. You urinate, so you're thirsty again. If you're waking up 2, 3, or 4 times a night to use the bathroom, and this has been going on for weeks or months, your body is trying to tell you something critical. Now let's talk about the third warning sign, and this one catches people completely off guard. Unexplained weight loss sounds like a good thing, doesn't it? Who wouldn't want to lose weight without trying? But when you're losing weight while eating the same amount or even more, that's terrifying. Here's what's happening inside your body. When your cells can't get glucose because of insulin problems, they start breaking down muscle and fat for energy instead. You're literally wasting away from the inside, and people often celebrate it until they realize something is seriously wrong. The fourth sign is extreme fatigue that no amount of sleep seems to fix. You wake up tired. You're tired all day. You go to bed exhausted. Coffee doesn't help. Rest doesn't help. Nothing helps. Most people blame stress, busy schedules, or getting older. But diabetes fatigue is different. Your cells are starving for energy because glucose can't get inside them properly. It's like having a full gas tank but a broken fuel pump. Your body has energy available, it just can't use it. This leaves you feeling drained, weak, and unable to function normally, no matter how much you sleep. Here's the fifth warning sign that almost everyone dismisses. Blurry vision that comes and goes. You probably blamed it on screen time, right? Too many hours on your phone or computer. Maybe you thought you just needed glasses. But fluctuating vision is a classic diabetes symptom that people ignore for years. High blood sugar causes the lens in your eye to swell, changing its shape and affecting your ability to focus. The scary part? This can lead to permanent vision damage if left unchecked. When your vision keeps getting blurry and then clearing up, that's not normal eye strain. That's your body telling you your blood sugar is out of control. The sixth sign is slow healing wounds and frequent infections. Got a cut that won't heal? A bruise that's been there for weeks? Skin infections that keep coming back? Most people think they just have sensitive skin or bad luck. But here's the reality. High blood sugar damages your blood vessels and impairs your immune system. This means your body can't fight off infections properly and can't heal wounds efficiently. Women often notice recurring yeast infections. Men might experience more skin infections or athlete's foot that won't go away. These aren't random occurrences. They're your immune system struggling because diabetes is weakening it. Now for the seventh and perhaps most overlooked warning sign. Tingling or numbness in your hands and feet. You probably blamed it on sitting too long or sleeping in a weird position. Maybe you thought your shoes were too tight. But persistent tingling, numbness, or burning sensations in your extremities is called peripheral neuropathy, and it's one of the earliest signs of diabetes nerve damage. High blood sugar damages the tiny blood vessels that feed your nerves, especially in your hands and feet. This damage is often irreversible, which is why catching it early is so critical. If your feet feel numb, tingly, or like they're burning, especially at night, that's not normal. That's nerve damage happening in real time. Let me tell you why these signs are so dangerous. They develop slowly, over months or even years. Each one seems minor on its own. You're a little thirsty. You're tired. Your vision is slightly off. None of it seems like an emergency, so you don't do anything about it. But while you're ignoring these signs, diabetes is silently damaging your body. Your blood vessels are deteriorating. Your nerves are dying. Your organs are struggling. And by the time you finally get diagnosed, you might already have complications that could have been prevented. Here's what makes this even more frightening. Type 2 diabetes doesn't just appear overnight. There's a stage called prediabetes where your blood sugar is higher than normal but not quite high enough for a diabetes diagnosis. During this stage, you can still reverse the damage. You can prevent diabetes from developing. But only if you recognize the warning signs and take action. Most people with prediabetes have no idea they have it because they're ignoring exactly these 7 signs we just discussed. So what should you do if you're experiencing any of these symptoms? First, don't panic, but don't ignore it either. Schedule an appointment with your doctor immediately. Ask for a fasting blood glucose test and an A1C test. These simple blood tests can tell you exactly where you stand. The fasting blood glucose test measures your blood sugar after not eating for at least 8 hours. The A1C test shows your average blood sugar levels over the past 2 to 3 months. Together, these tests give a clear picture of whether you have diabetes, prediabetes, or if your blood sugar is normal. But here's the good news. If caught early, type 2 diabetes and prediabetes can often be managed or even reversed through lifestyle changes. I'm talking about real, sustainable changes in diet, exercise, and stress management. Studies show that losing just 5 to 7% of your body weight can significantly reduce your diabetes risk. That's only 10 to 15 pounds for someone who weighs 200 pounds. Regular exercise, even just 30 minutes of walking 5 days a week, can dramatically improve your blood sugar control. And cutting back on processed foods, sugary drinks, and refined carbohydrates can make a massive difference. Let's talk about diet specifically because this is where most people get confused. You don't need some extreme diet or expensive meal plan. Focus on whole foods. Vegetables, lean proteins, healthy fats, and complex carbohydrates like whole grains and legumes. Avoid sugary drinks completely. 1 can of soda contains more sugar than your body should process in an entire day. Replace it with water, unsweetened tea, or sparkling water. Cut back on white bread, white rice, and pasta. These spike your blood sugar faster than candy. Instead, choose brown rice, quinoa, whole grain bread, and plenty of vegetables. Exercise doesn't have to mean joining a gym or running marathons. Your muscles use glucose for energy, so any physical activity helps lower blood sugar. Walking after meals is incredibly effective. Just a 15-minute walk after dinner can prevent blood sugar spikes. Strength training is also powerful because muscle tissue uses more glucose than fat tissue. The more muscle you have, the better your body handles blood sugar. You don't need fancy equipment. Bodyweight exercises like squats, push-ups, and planks work perfectly. Stress management is the piece most people forget. Chronic stress raises cortisol levels, which increases blood sugar and promotes insulin resistance. Finding ways to manage stress isn't just good for your mental health, it's critical for preventing diabetes. This could be meditation, yoga, deep breathing exercises, spending time in nature, or whatever helps you relax. The key is making it a regular practice, not just something you do when you're already overwhelmed. Sleep is another crucial factor that doesn't get enough attention. Poor sleep or insufficient sleep disrupts your hormones and makes your body more resistant to insulin. Adults need 7 to 9 hours of quality sleep per night. If you're constantly sleep deprived, your diabetes risk skyrockets. Create a consistent sleep schedule. Make your bedroom dark and cool. Avoid screens for at least an hour before bed. These simple changes can significantly improve your sleep quality and your blood sugar control. Now, I need to address something important. Some people have risk factors that make them more susceptible to diabetes regardless of lifestyle. If you're over 45, have a family history of diabetes, are overweight, have high blood pressure, or belong to certain ethnic groups including African American, Hispanic, Native American, or Asian American, your risk is higher. This doesn't mean you're doomed to get diabetes, but it does mean you need to be extra vigilant about watching for warning signs and getting regular checkups. Women who had gestational diabetes during pregnancy have a much higher risk of developing type 2 diabetes later in life. If this applies to you, regular screening is essential. Women with polycystic ovary syndrome also face increased diabetes risk. These aren't things you can change, but they are things you need to be aware of so you can take preventive action. Let me share something that might surprise you. Many people who develop diabetes could have prevented it if they had recognized the warning signs earlier and taken action. The progression from normal blood sugar to prediabetes to diabetes takes years. During that entire time, your body is sending signals. The 7 signs we discussed today are those signals. Ignoring them doesn't make them go away. It just gives diabetes more time to cause irreversible damage. Here's what I want you to do right now. Think back over the past few months. Have you experienced any of these 7 warning signs? Constant thirst? Frequent urination, especially at night? Unexplained weight loss? Extreme fatigue that won't go away? Blurry vision that comes and goes? Slow healing wounds or frequent infections? Tingling or numbness in your hands or feet? If you answered yes to even one of these, especially if it's been ongoing, you need to get tested. Don't wait for it to get worse. Don't assume it's nothing. Your body is trying to protect you by sending these warnings. The difference between catching diabetes early and catching it late can be the difference between managing it with lifestyle changes versus needing multiple medications. It can be the difference between healthy vision and diabetic retinopathy. Between healthy kidneys and kidney disease. Between feeling your feet and having permanent nerve damage. These aren't scare tactics. These are real consequences that happen to real people who ignore the warning signs. Remember, diabetes is called a silent killer for a reason. It damages your body quietly, without dramatic symptoms, until suddenly the damage is severe. But it's only silent if you're not listening. Your body is talking to you through these 7 signs. The question is, are you going to listen? Or are you going to keep dismissing them as normal until it's too late? Take action today. Call your doctor. Schedule that appointment. Get your blood sugar tested. If the results are normal, great. You have peace of mind. If they show prediabetes or diabetes, you caught it early enough to do something about it. Either way, you win. Ignoring it is the only losing option. Your health is worth the time it takes to get checked. Your future self will thank you for paying attention to these warning signs now, before they become a crisis you can't reverse. Your body is incredibly smart. It knows when something is wrong long before you do. These 7 warning signs are its way of protecting you, of giving you a chance to fix the problem before it becomes unfixable. Don't waste that chance. Listen to what your body is telling you. Act on it. And take control of your health before diabetes takes control of you.